I'm a clinical psychiatrist and published author. I'd like to talk about something that's relevant to all medical professionals: the use of narratives in medicine. Let me begin with a case study sent to me by a colleague who shares my interest in the subject. The study featured a 30-year-old man who was hospitalized for severe panic attacks. He was treated with narcoanalysis, but feeling no relief, turned to alcohol and endured years of depression and social isolation for decades later. He was back in the psychiatric system. But for the first time he was prescribed the antidepressant Zoloft 6 weeks later. It was discharged because the panic attacks and depression and disappeared. He lived a full life until his death. 19 years later, if the narrative was striking, was even more so, for its inclusion in a medical journal. Repeatedly, I've been surprised by the impact that even lightly sketched case histories can have on readers. In my first book, I wrote about personality and how it might change on medication. My second was concerned with theories of intimacy. Readers, however, often use the books for a different purpose: identifying depression. Regularly, I received and still receive phone calls. People saying my husband's just like X1 figure from a clinical. The readers wrote to say that they'd recognize themselves seeing that they weren't alone, gave them hope. Encouragement is another benefit of case description, familiar to us in an age when everyone's writing their biography. But this isn't to say that stories are a panacea to issues inherent in treating patients, and that can be disadvantages. Consider my experience prescribing product when certain patients reported feeling unwell after receiving it. Presented these examples person essays for psychiatrists, and then in my book, or I surrounded the narrative material with accounts of research in time. My loosely supported descriptions let others to do controlled trials that confirm the phenomenon. But doctors hadn't waited for those controlled trials in advance. The better than well hypothesis had served as a tentative fact. Treating depression colleagues looked out personality change, even aimed for it, even though this wasn't my intended outcome. This brings me to my next point. Often the knowledge that informs clinical decisions emerges when you stand back from it. Like an impressionist painting, what initially seems like randomly scattered information begins to come together. And what you see is the bigger picture. That's where the true worth of anecdote lies, beyond its role as illustration, hypothesis builder, and low-level guidance for practice storytelling. There's a modest counterbalance to a narrow focus on data. If we rely solely on evidence, we risk moving toward a monoculture, whereby patients and their afflictions become reduced to inanimate objects. A result I'd consider unfortunate, since there are many ways to influence people for the better. It's been my hope that while we wait for conclusive science, stories will preserve diversity in our theories of mind. My recent reading of outcome trials of antidepressants has strengthened my suspicions. The line between research and storytelling can be fuzzy. In medicine, randomized trials are rarely large enough to provide guidance on their own. Statisticians amalgamate many studies through a technique called meta-analysis. The first step of the process, deciding which data to include, colors the findings. Effectively, the numbers are narrative. Put simply, evidence-based medicine is judgment-based medicine, which randomized trials and carefully assessed and given their due. I don't think we need to be embarrassed about this. How substantial formal findings require integration. The danger is in pretending otherwise. I've long felt isolated in embracing the use of narratives in medicine, which is why I warmed to the likelihood of narratives being used to inform future medical judgments. It would be unfortunate if medicine moved fully to squeeze the art out of its science by marginalizing. The narrative stories aren't just better at capturing the bigger picture but the smaller picture too. I'm thinking of the article about the depressed man. Given the drug Zoloft, the degree of transparency information in the patient was just as impressive as the length of observation. No formal research can offer a 40-year leading or a 19-year Follow-up few studies report on both symptoms and social progress. Research reduces information about many people. Narratives retain the texture of life in all its forms. We need storytelling, which is why I'll keep harping on about it until the message gets through. The number of skin diseases. Atopic dermatitis is a common cause of eczema, but it's more prevalent in the patients with asthma and hay fever. The signs and symptoms of eczema include tiny blisters, or vesicles that can weaken and lose, eventually producing crusted, thickened plaques of skin. It is always quite itchy. It is significant to distinguish the different causes of eczema, as the effective treatments will also differ. Eczema's star. As red raised, tiny blisters, containing a clear fluid atop red, elevated plaques. And when these blisters break, the affected skin starts to weep and use, and chronic eczema. The blisters are less prominent and the skin is elevated, thickened and scaly. There are about 11 distinct types of skin conditions that produce excellent atopic dermatitis. Tends to begin early in life with those with a predisposition to India and allergies, but it probably does not have an allergic basis. Characteristically, rashes occur on the cheeks, neck, elbow and knee creases and ankles. Irritants. Dermatitis occurs when the skin is repeatedly exposed to toxic substances or due to excessive washing. Allergic contact dermatitis occurs after repeated exposures to the same allergic substance. The immune recognition system becomes activated at the site of their next exposure and produces a dermatitis poison. Ivy allergy is a good example of allergic contact dermatitis. Stasis dermatitis commonly occurs on the swollen lower legs of patients who have poor blood circulation in the veins of the legs. Fungal infections can produce a pattern similar to many other types of eczema. However, the fungus can be visualized with a scraping under the microscope, or grown in culture. Scabies is caused by an infestation by the human itch mite and produces a rash, very similar to other forms of eczema. It's very common and affects the hands and occasionally the feet by creating an itchy rash composed of tiny blisters on the side of the fingers or toes and palms or soles. Lichen simplex chronicus produces thickened flags of skin, commonly found on the shins and neck. None of you are. Eczema is a non-specific term for coin-shaped plaques of scaling skin. Most often on the lower legs of aged persons. In the cirrhotic eczema, the skin will crack and choose due to excessive dryness. Seborrheic dermatitis produces a rash on the scalp, face, ears and occasionally the mid-chest in adults and infants. It produces a weepy, sooty rash behind the ears and